So I'm just going to go over an OB limited protocol. So here's a few things that are needed for this protocol. You have the cervix, which is going to be with and without measurement. That's 2 images. The lower uterine segment, that could be 1 to 3 images. You want to go ahead and make sure that you image the full placenta, so that's 2 to 6 images in Sag and Trans. Heart rate should be 1 image, stomach should be 2, bladder could be 1 to 2. It just depends if you want to go ahead and use dual screen. For the with and without color, you got femur length, which is 1 image, and the biparietal diameter and head circumference, which should be 1 image. So starting with the cervix, you have 2 images that you're going to have to go ahead and image. It's going to be 1 with and without measurements. You have to visualize the internal os, the external os, and the cervical canal. So on your calipers here, here's your internal os, your external os, your cervical canal, and baby's head. And on this one, it's just not measured here with caliper, so you have your internal, your external os, cervical canal once again, and then the baby's head. On these, I think it's quite a zoomed out on these images. I probably could have went on ahead and brought the depth in quite a bit. Next is the lower uterine segment, which can be annotated LUS. This image needs to be taken in sagittal to show fetal lie in relation to cervix. This could be cephalic or breech depending on the baby's lie. So here's a little bit of amniotic fluid here, the uterine wall, baby's head, and baby's body. And then here we have it labeled LUS cephalic since baby's head is towards mom's cervix. Now we're at the placenta. The placenta must be visualized in sagittal and transverse. Sometimes it is possible to fit the placenta in one whole image, but it is best to elongate it out and see each section to rule out any abnormalities. So here's 3 images that I took of the placenta in Sag. You want to go ahead and get the placental edge here. Here's some amniotic fluid, baby, in the uterine wall. Uterine wall once again. Here's placenta, some of baby in the amniotic fluid, and this one is just showing more of a mid area of the placenta, and then you want to keep moving down and make sure that you show the edge of that placenta again on the other side. Here's some of baby, uterine wall once again, some amniotic fluid. On this image here, I think I could have probably got this a bit more clear and clear out the borders here because it is kind of fuzzy. And same thing with this one, I believe. It's not as clear. I mean, you can tell where the placental edge is. It's just not as clear as I would want it to be. And then I have 3 more here that are placenta and they're in transverse. So once again, you want to see that placental edge. Here's some amniotic fluid, the uterine wall, some of baby. And then you want to move your probe and make sure you get more of a mid area of the uterus. And then here's your uterine wall, baby, amniotic fluid. Once again, placenta, you want to get that edge again in here as much as you can. Here's baby, amniotic fluid, uterine wall. And then, so for these, like I said, you probably could get it all in one image, but you want to just go ahead and make sure that you're getting each section, and you want it to fill up your screen pretty well. Like, you don't want this to be way over here in this area and then have it fill up the rest of the screen this way. You just kind of want to make sure you have it filled all the way, and just make sure that you're checking for any abnormalities that can be present. So that's why it's really important to make sure that you image each one in each section this way versus just trying to get it all in one full image. And then when you're scanning, so I have learned that you can move around quite a bit on the patient. It's usually not just like in one area, if that makes sense. So I learned that you know, usually you can image it in one area almost, but you can really move around, you know, the patient to get these images, if that makes sense. So for the cord insertion, image the cord insertion while examining the placenta if possible. So here is the cord inserting the placenta. Here it goes down through this amniotic fluid here. It's going to insert baby. On this image is a lot better. You can see where that cord inserts the baby. Here it is inserting the placenta, some more amniotic fluid. You can almost see like the placental edge. Once you get to heart rate, you don't have to annotate heart rate because these images, once you start measuring, it's going to pop up on there for you. So M-mode is used for less than 27 weeks. Pulse Doppler is used for anything over 27 weeks. The cursor should be through an atrium and a ventricle. And then again, you don't have to annotate because it's going to annotate for you. So here's baby's heart. You can see baby's rib, baby's spine, and some amniotic fluid again. So this isn't the best image. I think I could have probably cleared this up a bit better because it's not as clear as I would want it to be. Whenever you do the heart rate, just make sure that you are getting a full cycle here. Some machines do require 2 cycles and some of them only require 1. It just depends on the machine that you're working on. When you're measuring the abdominal circumference, it must be measured at the level of the portal sinus and the umbilical portion of the left portal vein. The abdomen must be round and not oval. You have to measure tight to the skin line, so you just want to kind of imagine a belt. Too much pressure can compress the abdominal cavity, so you just want to be careful and make sure that you're not compressing too much. And then you do not want to image with the kidneys. Don't put the kidneys in this image. So adrenal glands are fine, but just make sure that the kidneys are not in this image. So here's some abdominal circumference images. I guess this is actually the best one because it's measured. You want to measure posterior to anterior to the fetus. Here's your portal vein. Here's your stomach, aorta, spine. Here's some rib. And you want it as tight as possible. So like I said, just imagine like a belt. You want it as tight as possible around the abdomen. And then you can image this with the adrenal glands. Like I said, you just don't want the kidneys in this image. It's not going to be right. Here's the spine again, stomach. Here's that portal vein, aorta, and it just goes more into depth. I like this image because it does show you a lot more. Femur length. Again, you don't have to annotate these images because it is going to be annotated for you. Attempt to elongate the femur straight across the screen, and you want to measure from diaphysis to diaphysis. So like on here, you have it point to point there. You don't want to measure it out here into the epiphysis because that's not going to be correct. Here's baby's thigh, and then you have a little bit of amniotic fluid here as well. Just make sure that you are trying to get it as straight across on the screen as possible. And then here's a little bit of shadowing coming down from that bone there. For the BPD and the HC, some landmarks that should be visualized include the CSP, the thalamus, the midline falx, and then the columns of the fornix. The cerebellum should not be included. You don't want this in your image because you're not going to be in the correct plane and your measurement will be incorrect. The BPD is measured from outer to inner across the thalamus, and then the head circumference is measured from outer to outer. So here you have your BPD measurement. You want to go ahead and measure outer to inner on this. So here's outer and then here's inner. You don't want it to be out here. You want it to be in. The asterisks here are going to be your thalamus. This is your third ventricle going through. This arrow is pointing to the CSP. And then you have your calvarium. This next photo here is your head circumference. You can measure this one outer to outer. And then this can actually be done in the same image. Your BPD and your head circumference can all be put in one. Here's your BPD and your head circumference put in the package. It doesn't have to be 2 separate images. And for the head circumference here, we have the thalamus again. You have your third ventricle, the calvarium, and then here's your falx going through. And then, like I said, just remember that this one can be put in the same image. It doesn't have to be 2 separate ones. For the bladder, there's 2 images that are needed in transverse, with and without color, to demonstrate 2 umbilical arteries. The image without color should be labeled bladder. The image with color should be labeled 2UA, which stands for 2 umbilical arteries. When you see where the cord inserts the abdomen, angle towards the bladder to see both umbilical arteries. Sometimes if you're too coronal, you can get the iliac arteries, which you don't want. So for this image, you just want to go ahead and label it bladder. These 2 you want to go ahead and label 2UA because it is demonstrating the 2 umbilical arteries. So here's baby's bladder. You can tell that this is a boy here, some amniotic fluid and baby. And then you have the baby here again, and then here is the cord, the 2 umbilical arteries wrapping around the bladder. And then here we go again, the 2 arteries wrapping around the bladder, the cord, baby, and then I couldn't decide between these 2, but I do like this color Doppler better. I just think it looks a lot prettier. With fetal presentation, I know this slide looks a little, messy. I tried color coding these. I think it kind of helps me. If the probe and the image are the same, then the fetus is always long. If the probe and the image are different, then the fetus is always transverse. So the first thing you want to do is figure out if this is going to be a long or transverse lie. Once you figure that out, if you know the fetus is long, you can figure out if the fetus is breech or cephalic. So I used this yellow highlighter here to tell you, like, okay, well, now you know that it's long, it's going to either be breech or cephalic. So these are going to go together. Once you know if the fetus is transverse, you can figure out if the fetus is maternal right or maternal left. So I color coded that with that transverse, so they're both green. And then the two sayings here that we want to remember are at 3 o'clock you turn right with RC Cola and go to church. At 9 o'clock you turn left and go to the bar. So I highlighted these green because, again, if you know it's transverse, then we're going to go with maternal right or left. So here's that green. And then if it's long, you want to either be breech or cephalic. So the church and the bar, the C is for cephalic and the B is for breech. So as long as you memorize these two and just know that certain parts of the, I guess you can call it equation, those go with these specific things. So that's why I color coded it. I don't know if that's going to be confusing or if that helps, but that's what I came up with and it helps me. All right, so here's some examples I have for fetal presentation. So here is an abdominal cut of a fetus. Here's the spine, stomach, the portal vein, and some amniotic fluid surrounding the baby. This probe we know is transverse. This image we know is a transverse cut. So since they're the same, we know that this is a long lie. We have to determine where the stomach is. So here's the spine. The spine is always at 12 o'clock, and we're going to go around the clock. We're at 3 o'clock now. The stomach is at 3 o'clock. So now that we know that the stomach is at 3 o'clock, we refer back to our formula or little equation. At 3 o'clock, you turn to the right to go to church. So the turn right part, again, has to do whenever it's in a transverse lie. You ignore that part, and you go to the portion where it says go to church. Church starts with a C, and so does cephalic. So now we know that this baby is in a long lie, and it is cephalic. Now let's say that this probe is switched, and now it's a sag, and we know that this image is transverse. So we know that those are different. So since they're different, this is going to be a transverse lie. And now that we know that it's a transverse lie, we have to determine whether or not the head is towards the maternal right or left. So now we know again that the stomach is at 3 o'clock. So we refer back to that saying, at 3 o'clock, turn right to go to church. You ignore the church part. We're just going to pay attention to the turn right so that we know that this baby is in a transverse lie and the head is towards the maternal right. So on this example here, we know that the probe is sag, and we can tell that this is a sagittal image. So since they're the same, we know that this is a longitudinal lie. Here is baby's bladder. Here's the stomach and the heart, and then you can see the spine a little bit here. So now that we know that this is sag and this image is sag, we know that it's a long lie. This is going to be anterior, this is going to be posterior, superior, and inferior. So here's baby's heart. So we know that this baby is cephalic since this head right here is towards the bottom part or the cervix of mom. So this is going to be a long lie, and it's going to be cephalic. I hope this makes sense. I know I kind of went through it kind of quick, but I do believe that my previous slide helps a lot with it being color-coded. It was just kind of hard, I think, to figure out what part of the equation, or I guess you can call it that, what part had to do with which section, if that makes sense, because you're reading the whole thing and it starts getting confusing. You're saying turn right, turn left, and church and bar, and it would just, to me, it didn't make sense at first, but I really think breaking it down and color coding it helped quite a bit. And here's my reference slide. I do have a lot of references. Some images I did get to take off of StudyCast. A lot of these images, though, I did have to take off from online because I didn't have a whole lot saved on StudyCast. And that's it.